Autism is a developmental series of disorder known as autism spectrum disorder or ASD, which means there's a large spectrum of functionality in the individuals. Some individuals may only have slight behaviors, while others are more severe. Individuals with ASD typically show signs during early childhood, which include difference in communication, lack of interest in interpersonal relationships, and restrictive behavior. There are several different forms of therapy which help lessen the symptoms of autism spectrum disorder. Autism affects 1 out of every 200 to 300 children in the United States. Due to the expansiveness of ASD, it is important for people and organizations to be aware and educated about autism. The signs of autism typically show before the age of 3. The early behaviors include social difficulties, communication challenges, and unusual interests. Certain social difficulties that children with autism may experience are avoiding eye contact, trouble interacting with others, and ignoring people when they're spoken to. Infants can also show social difficulties by not smiling and disliking being comforted. Examples of challenges in communication in children with ASD involve delayed speech, being nonverbal, the repetition of words or phrases, and the absence of gestures when speaking. Behaviors of unusual interests may include being more interested in objects than in people, strong reactions to different stimuli, and becoming upset when there's a change in his or her routine or environment. Due to the complexity of autism spectrum disorder, there is no single cause of autism. There are several contributors and risk factors that are linked to autism, but they're not always the cause of ASD. Different genetic mutations have been linked to ASD. The genetic mutations increase the susceptibility to autism and control how mild or severe the symptoms are. The interactions of genes and environment can also be a cause. Contact with a certain chemical or infection could cause autism in an individual who is vulnerable due to the genetic mutation. Scientists are also researching biological factors that could play a role in autism, such as problems with brain connections, overgrowth in different areas of the brain, and immune system problems. The advancement of parents' ages could also increase the risk, along with pregnancy or birth complications. Children with autism spectrum disorder understand false belief at a slow rate, which causes some researchers to believe that the absence of theory of mind or mind blindness is the defining characteristic of ASD. Theory of mind is the connection between thoughts, beliefs, interactions, and behavior that cause an understanding of the link between mind and behavior. Other scientists believe that although autistic children have trouble with false belief tasks, mind blindness is only a side effect of ASD instead of the cause of the symptoms. The image on the far right shows different behaviors of the theory of mind people with ASD may have. Some included are difficulty explaining one's own behaviors, difficulty understanding emotions, and problems differentiating between fact and fiction. Different strategies to help are practicing social situations, teaching how to read nonverbal cues, and teaching the concept of feelings and emotions. There are many different types of diagnoses available to individuals to determine if they have ASD and where on the spectrum they may appear. A precise diagnosis must be centered around the individual's communication, social interactions, and his or her interests. A medical diagnosis requires a practitioner to assess the patient. A medical assessment includes a medical history of the mother's pregnancy, developmental milestones, coordination, eating and sleeping habits, any family history of disorders, a physical exam, and routine lab tests. School evaluations are made when a child is suspected of having a disability. Under the Individuals with Disabilities Education Act, parents can request evaluations, or the school system may determine if one is necessary and request parental permission. The evaluation is performed by a multidisciplinary team that includes the teacher and a specialist in the area of the suspected disability. The child must be assessed in all areas that are related to the assumed disorder, which include health, vision, hearing, communication, motor skills, and emotional status. A reevaluation is made once the child has received special educational services to record if the child is meeting their goals. Therapy for children with autism spectrum disorder is different for each individual because every child with ASD has unique symptoms which requires treatment that caters to his or her specific needs. Applied behavior analysis is one of the most common forms of therapy for children with ASD. Applied behavior analysis is successful when the therapy begins when the child is younger than 5, and it teaches children with autism social, motor, and verbal behaviors. Applied behavior analysis also works on reasoning skills and managing challenging behavior. Applied behavioral analysis reinforces positive behaviors in the individual to lower the chance of the child participating in any negative behaviors. Relationship Development Intervention, or RDI, is a modern form of therapy for children with ASD. The goal of RDI is to teach children with autism to think flexibly and to participate in social relationships. RDI typically begins with helping children form relationships with their parents or family. Other forms of therapy include sensory integration, because many children with ASD have sensory problems. Some children are overly sensitive to different stimuli such as sound, textures, and light, while others aren't sensitive enough. The goal of sensory integration therapy is to help control a child's reaction to different stimuli. Many exercises are in the form of entertaining activities such as games to make it more enjoyable and to prevent overwhelming the child. Different forms of sensory therapy include swinging, aerobic exercise, and vibration therapy. Occupational therapy also helps people with autism develop skills that they have trouble with. Occupational therapy involves a combination of exercises that includes physical activities to help with body coordination and awareness, play activities to help with communication and social interaction, developmental activities such as tying shoes, and adaptive strategies such as coping and transitions. The benefits of occupational therapy for children with autism involve helping children with ASD improve their quality of life at home and school. Occupational therapy helps promote many different skills, such as daily living skills, fine and gross motor skills, posture, body awareness and its relation to others, visual skills, problem solving, and social skills. Improving those skills with occupational therapy could help a child with autism be able to develop adult and peer relationships, express feelings in appropriate ways, learn how to focus on tasks, and learn how to self-regulate. As research on autism spectrum disorder increases and expands, it's important for awareness and education to be spread. Being educated and aware about autism is important in society because it will reduce discrimination and encourage advocacy for those with ASD. Autism awareness and acceptance is especially important in school and work environments to ensure a support system for children and adults with ASD. Individuals with Disabilities Education Act protects children with autism from discrimination in the school system and provides services required to help improve their skills. Autism Speaks is an organization that is dedicated to promoting solutions for the needs of individuals with autism and their families. The organization advocates and supports people with ASD, increases understanding and acceptance for people with autism spectrum disorder, and promotes advances in treatments and research. Autism awareness also involves the inclusion and acceptance of individuals with ASD. Programs such as Best Buddies helps promote inclusion by helping individuals with disabilities form friendships, secure jobs, live independently, and self-advocacy. Autism spectrum disorder affects more than 3.5 million individuals in the United States. Autistic behavior is recognized in early childhood and varies from problems with social interaction to challenges with communication. Although there is no single cause of autism, genetic mutations, environmental factors, and biological factors are shown to increase the risk of showing behaviors. Each case is unique and varies in how mild or severe the symptoms are, which makes it important for different options of therapy for each individual. Organizations such as Autism Speaks raises awareness, supports, and advocates for children and adults with autism spectrum disorder. It's important for people to be inclusive and accepting of individuals with ASD. I chose this topic for my research paper and presentation because in the future, I will work with children that have autism spectrum disorder because I am planning on becoming an occupational therapist. It's also really interesting because there are different types of symptoms and the varies between each case. And then here's my slide with my references. Thank you.